Hello, and welcome to Plastic Surgery Tales, the podcast about plastic surgery. Today, we're going to share the intimate and empowering stories of those who have chosen to take this journey. In each episode, you'll hear firsthand the remarkable journeys of our patients, but not just the patients. We're going to be sitting down with some of the world-renowned plastic surgeons who have helped us change these lives. Welcome to Plastic Surgery Tales. I'm your host, Holiday, the golden child. And today we're going to kind of take a step into your journey through the patient's eyes. I have sitting here with me one of our patients, Gretchen. Gretchen, we want to understand its impact and your experience in the plastic surgery world. So let's just jump right into it. First, where are you from?
I am from Puerto Rico, but I live here in Florida.
But you live here in Florida, okay. And what have you had done?
Well, my plastic surgery history is long because I was 300 pounds about 5 years ago. So I lost 145 pounds and I had a lot of extra skin everywhere. So in the last 3.5 years, I've been doing different types of surgery to get that fixed. So I had a tummy tuck, I had breast lift and augmentation, back lift, arm lift, BBL, and lastly...
Can we see this? Because it sounds like, well, guys, I'm looking at it in person. Okay. It looks great.
There you go.
Okay, yes. Can we do a little?
Oh, yeah. I'll show you.
Oh, yeah, give me a little. Okay. Ay. You know me in Miami, everything is spicy. We love that. Could you... So you had an arm lift, back lift. I just recently had back and arm lipo. Mm-hmm. And J-plasma to tighten the skin. I didn't do the back lift, but I did do the J-plasma because I understand how skin gets loose. Elasticity is not our best friend. Gravity is not our best friend as a woman. But before we jump into this, I'm so intrigued to talk about how did you lose the 300 pounds? Because I am an advocate as well of knowing what it is to be 300 plus pounds and dropping the weight naturally. And then now you have this excess skin and everybody around you is like, when are you going to stop doing surgery? They have no clue what you have been through to even get to this place. So just tell us, like, you were 300 pounds. What made you want to lose the weight? How did you do it? And clearly we see the results.
Oh, well, thank you.
Yes.
Well, so I was 300 pounds and I was feeling very bad about myself. And I wasn't the 300-pound shaped woman. I was the 300-pound pretty.
You was giving Butterball?
Yeah.
It's okay, baby. It's okay. It's okay.
And I'm 5'3", so it was a lot of weight.
It's a lot of weight
for me. I wasn't able to move around as well with my kids, like running up after them and all these things were very difficult. And I was feeling very self-conscious about myself. So I decided to do a bariatric surgery. So it wasn't completely natural. I used some help.
You needed some help.
Yeah.
That's okay.
So I had the gastric sleeve. And after that, I committed to a keto diet.
Awesome.
And I've been doing so for the last 5 years.
Awesome. And keto, I've heard so much good things about keto. I personally have never tried it. So what does keto look like?
So I eat mainly greens and protein.
And protein.
Mm-hmm.
Love it. Love it. So now, after you lost this weight, what happens next?
Well, then I had about 20 plus pounds of extra skin.
Wow.
And that was another process, right? So I went through my first rounds of taking all the extra skin, and I was feeling good about myself, but I still felt that it was not as shaped as I wanted to. So that's why I came to New Life to get it kind of completely done.
Completely done. Could you walk us through your decision-making process before surgery? What were your main considerations? Mm-hmm. What were the factors and circumstances that led you to consider plastic surgery? I mean, I know that you had the shaggy skin, but what was the ultimate decision in that process?
But for this last one that I had the lipo,
yes.
I had a lipo 360 here. And for this last one, it was a little difficult because I didn't need it. the surgery. It was the first surgery that it was just because I wanted to.
You wanted to.
So I was a little scared, and then it was the first time that I did surgery with a doctor that was not the previous one. So I was a little nervous, a little scared. I did a lot of research. I felt really comfortable with the way that the coordinators answer all my questions, and
Awesome.
it felt really good that I was able to talk to Dr. Manny before surgery and just ask all the questions. And
He's
he was
sweet. He's a good guy.
He is.
Yes.
He's sweet and he's funny too.
Yes, he's funny too. Yeah.
So that helped a lot to make myself feel a little bit more comfortable.
Awesome. I love that for you. So let's go through those surgeries again. Can you list them for me?
Yeah. So I had tummy tuck. I had arm lift, back lift. I had eyelid lift. That's something that people don't talk about, but
It's okay, girl. I had a nose job. Don't worry about it. It looks good, and I would never know.
So when you lose weight, everything changes.
Everything changes.
The face too. So my eyelids went down, like they were very droopy. So I had that as well. It added a lot of years that I don't have.
Right.
So
You look very young and refreshed right now.
Thank you,
Yeah.
thank you. So I had an eyelid, and then lipo 360, and breast augmentation.
Love that. Love that.
Oh, BBL.
And BBL.
Yes.
What was the specific moment or experience that promoted you to decide to undergo the surgery?
For my first surgery, it was just seeing the skin. It was like I couldn't really enjoy
The weight loss.
because
Right.
I had like this extra person on top
Yes,
of me.
yes.
And also you get the rashes, you get infections,
Wow,
it's
because
very
of the extra skin.
yeah, especially in the abdomen.
Trying to keep it clean. It was that much skin.
It was in the abdomen. It was almost 10 pounds.
Do you have like a before picture?
Oh yeah. Yeah, I do.
Can we see that? You got rid of? Can we see her?
Sure.
Let me
There
see.
you go.
No.
Yeah.
No.
Sometimes it's hard for me to.
Do you guys see that? Do you guys see that? Do you
Yeah.
No. Hunty, you deserve a round of applause.
Thank you.
Because if that is not the ultimate transformation, I don't know what is. Girl, if I show my before pictures too, we would be...
I'd love to see that.
Oh my God, yes. We'll save that for another day.
Okay.
But so what were your I'm still astonished, guys. Just give her another round of applause because that is an amazing, amazing transformation. And I love that for you. I see a ring on your finger. I know the hubby is probably loving it. The kids are enjoying the more energy. The beaches are different. Vacations are different. All those things are different. When you were deciding surgery, did you have any close people to you or any supporters or anybody that you had a discussion with prior to doing this?
Sure. I mean,
And were they an influence on your decision as well?
So I talked to a lot of people, like my family, and at that point I'm divorced, but at that point my husband, I talked to him as well, and you know they were very.
Coincidentally, I just have one question, not to get off topic.
Yeah.
Did the divorce happen before the new body or after the new body?
After the new body.
Honey, listen, I'm not saying it.
That's another topic to another podcast.
Another day. Go ahead, honey.
So they were very supportive, especially my ex-husband was very supportive. I documented all my process in social media. Like when I started like losing the weight, I used to like do live videos when I was doing exercise and all these things. And I also shared with my community online that I was gonna do this. And it was a mixture of opinions. Some people were, yeah, go for it. Some people were, no, you don't need it. And some people were like, oh, you're going to die, you know, all these things, right? But there was also a lot of pushback after the surgery from people. So I think that at that point, it was more about what I needed. I wanted to feel good about myself. People will always have opinions. And I have learned over the years that you can't please everybody. It's just impossible.
You cannot. And I also always tell people, I recommend them, like, when you're about to get surgery, don't tell everybody. keep your business to yourself. You know why? Because at the end of the day, all these opinions, negative or positive, may have a negative or positive impact on your decision, your choice, your process, your mental, all of those things. So it's important that you do have a supportive community, supportive people around you to help you through this process. What steps did you take to ensure you were asking the right questions and being well informed about your decision?
Yeah, so I watched a lot of videos online and read a lot of things. For me, it was very important that the doctor was a good one and he had a good reputation, and that I could see other patients online that were sharing their experience. So that was very important for me to have as well. And then when I came for the lipo, which was the last one, I had questions also about what to expect, since I had so much surgery before. What was going to be the change? So Dr. Manny was great about giving me realistic expectations and answering my questions and things like that.
You said that you were online. So what were some of the other resources or communities that you kind of outsourced to get the right information towards your decision and background information on plastic surgery?
So I can't remember the websites right now, but there's multiple websites that you can go to check, like if the doctor have like any bad reviews or, or good reviews. So I did the research there. There's a lot of like Facebook groups, like different pages in Instagram or TikTok that talks about surgery, that people that share their experience. So that's where I went to.
Awesome. Gretchen, were there any reservations or fears that posed upon you prior to surgery and leading up to this? And if there were, how did you deal with that?
Yeah, there has been all of my surgeries, but I think the one that was the hardest was this last one, again, because the first one I was like, I'm willing to go through whatever to not live with this extra skin. And this last one, it was more like, you don't have extra skin. You look good. You just want to look better.
Yeah.
So what risks are you willing to take to look better? So that went in my head a lot. However, it came again to what I needed for myself and how I was going to feel more comfortable, and also that I felt that the doctor was safe and it was a good doctor.
Ultimately, are you happy with your results?
Oh, I'm very, very happy. Yeah.
Can you, in retrospect, is there anything you do differently pre-surgery preparation?
I think I did a really good job on preparing. Probably in some of my surgeries, I overbought stuff, because they go this like big list that people post online. And in this last one, I knew exactly what I needed. And so I think there's like overbuying or like getting too much in my head.
Yeah, because they're going to give you a generic list. And then once you've gone through this process a couple times, like, I don't need that. I don't need that. This works for me better. These certain products work for you. I know there's like pre-surgery jitters that you get. Were there any last minute like jitters that you had and like that were memorable, moments for you?
Yeah, I think I was very nervous when I was waiting for Dr. Manny.
Were you like biting down to your cuticles and like?
I was just asking, you really want to do this? And then I was thinking about the recovery. That's another thing that when you have been through it enough times, you know what you are about to get into. So I had all of that stuff in my head. But as soon as Dr. Manny walked in and he was, with his funny self, he calmed me down, and it was good after that.
Now let's fast forward. Surgery's done. You're coming out. You're home. What was that initial first look? Was it wow? Oh my God. Or was it like, this is not what I thought I was going to look like? Like, what was that initial first meet and greet with the new body?
Yeah, I was shocked because I was not expecting as much of a change. My waist was small already, so I didn't expect to be even more, that much more small. So it was shocking. I was like, wow, he did an amazing job, especially in the back. And also, I was I didn't have a BBL this time. But just by
I didn't think you needed it.
No, but just by him taking the fat on the upper back that really reshaped completely the BBL. So it looked really good. I was
And
very
guys, I know
happy.
you can't really get a full picture of Miss Gretchen here, but apple bottom, apple bottom, apple bottom. You know I'm from New York, so we are the city of the Big Apple, and I don't know what they call them in Miami, but that's definitely a Big Apple, and it's great. We love it. We love those. Let's talk about those. Is it really me moments? And have you had any of those since the surgery?
Oh my God, I have a lot of is it really me moments in the last 5 years since I started this process. Um, I think each surgery has been pretty shocking
Mm-hmm.
because I mean I have tried to have low expectations when I go in, especially because I knew when especially the first surgery, I knew how much skin I had.
Mm-hmm.
I knew how much work it needed to be done. So I was like, whatever is better than this, I'm
Right.
okay
Right.
with that. And it was shocking to see myself without all that skin, and it has been shocking to see myself like when the BBL happened. I was like, because when I lost the weight, I'm Puerto Rican. I always had some
Good
booty.
foundation. A good
I had a
foundation.
good
Yeah.
kind of foundation, but when
Yeah.
I lost the weight, everything just melted, and it was very. I felt very unattractive, and I feel like even after the tummy tuck, it still things were just like a little squarish, and I wasn't very happy with that. So after the BBL and now with the lipo, I was like, oh my gosh, was who has that curves? What's
Right.
that?
Right.
So I was very very happy about it.
You you have on this beautiful dress.
Thank
And
you.
so I want to talk about the transformation moment. How has wardrobe and fashion changed for you?
So that has been a pretty big thing. So I always loved fashion, but it was very hard to find clothes that fit with how much weight I had on me. And then after I lost the weight, I had to always use garments. And even with garments, you can see the extra
Yes,
skin.
yes.
So then I kind of scratched my itch for fashion with shoes. So I've been collecting shoes for a really long time. But then when I did my first surgery, I started being more into fashion, and I was doing like videos for boutiques and stuff for like reviewing their products.
Right, right.
And then in 2020, I decided to open my own boutique, and
Awesome. What's the name of the boutique?
Red Lips Boutique.
Red Lips. Oh, you got to give me some stuff before I fly out.
Okay.
Yes.
So I have an online boutique, and I'm about to open now a mobile boutique. So it's gonna be
Love
like in a
that.
truck.
Yes. We need that because women, we have unpredictable times of day and we need that pull-up service.
Yeah.
I love that. Well, shout out to entrepreneur because that was my next thing with this new body. What do you do for a living?
Well, I do a lot of stuff. For a living.
Okay.
I have my boutique, and I model most of my clothes. People just for some reason when I bring somebody else, they don't buy the clothes. I'm like, let me rest. And then I am also a psychotherapist. Mhm.
A psychotherapist.
Mhm.
Okay. And so you're like out here just theraping people through
Yeah.
their trauma.
Yeah, I work specifically with females. I've been doing that for quite some time. I was a psychotherapist before the surgery and all these things. So I work with females, especially with trauma, like self-esteem issues, life and work balance, and things like that.
Oh, we definitely got to jump on a live one day because
Mhm.
I've been talking about this type of friends that you keep and trauma bonding.
Mm.
So I usually, this media personality and podcasting is amazing because I don't think everybody gets that benefit of it, but for me, I self-therapy myself.
Mhm.
So I assess the problem, I notice it, and then we kind of take care of it. And I think talking about my life experiences, hence we're here, sharing your stories, being very transparent about your lifestyle and how you got through those moments, in life. I think it's very important to psychotherapy,
Mhm.
and just assessing it and attacking it and kind of putting it in this garbage bag and giving it to the garbage man who comes in the morning.
Sure.
Yeah, I love that. So when you're feeling fabulous, you probably want to show it off. What's your funny anecdotes about flaunting?
Um.
Like I'll give you one of mine. Like I know I'm fine, so sometimes like I kind of stroll down the supermarket aisles a little slower.
I think that I don't have any like funny ones, but I was pretty shocked, especially with the whole transformation of how much attention I get when I am in public spaces.
Welcome to the club.
It was,
Airports,
yeah,
Starbucks,
everywhere.
playrooms, kids' birthday parties. It
Yeah.
doesn't matter. Everywhere.
Oh, well, actually, I do have one. I was in New York, just Times Square, and a girl just came and asked if she can grab my booty.
Oh,
And I was
yeah.
like-
You'll get that. Can I grab the booty? I had people
touch
walk
it.
up. Can I just take a picture? And I'm like, do you even know who I am? They're like, I don't know who you are, but you look good. Can I get a picture? Like, so that's going to be so much more coming. I love that for you because I know I get tired of stroking my own ego sometimes. And it's nice when other people want to,
For sure.
stroke it for you. So that's a beautiful thing. I love that for you. Did the surgery experience bring about any changes in your daily routines and habits?
Well, I've been doing a lot of changes in my life, like eating better, of course, doing exercise and things like that. I'll say that probably, as it relates to surgery, is just making sure that I keep my eating habits well. Also, like the massages and things like that.
What is Gretchen's workout routine?
So I go to the gym about 4 times per week. I get dragged by my boyfriend. I do not like to exercise.
Oh, the new boyfriend.
Yeah, the new boyfriend. And
shout out to the new boyfriend.
and I do that, but more than anything, it's the eating. Like everything, it's done.
The eating.
Yeah.
I tell people it's 80% what you eat. The rest is the gym.
Right.
Abs are made in the kitchen. They're not made in the gym.
Mm-hmm.
So yeah, that's super realistic. We know recovery can be challenging. Do you have any funny, strange anecdotes you like to share about that period, like the healing process?
Yeah, well, I was very shocked this time about the amount of blood, and it kind of got me a little dizzy when I saw myself because I don't like blood.
Did you see have those moments when it like just squirted out when they pushed it?
Yeah. That was horrible. When I went to the hotel right after and I saw all the blood, I was like, what's going on in here?
Dying.
Yeah.
I'm feeling weak from seeing all the blood. I went through that. How did you handle that?
I just distracted myself with something else. I mean, I felt good. I wasn't in a lot of pain. I wasn't not feeling like weak or anything.
Right.
So it's just what it is.
It's so funny. One of my stories is one of my friends took care of me when I had a BBL, my last BBL. And when I took off the bodysuit and she saw the blood, because I'm standing on top of a wee pad, and literally like the blood is just like dripping out casually, and I don't even know what's happening. She looked and gave me this face like she saw a ghost. I said, "Are you okay?" And she literally fainted.
Oh.
When she came to, I was like, "Are you okay? Can you help me get in this faja?" She was like, "Absolutely not." I had to figure it out myself because she couldn't see the blood. And as I'm pulling out my faja, it's squeezing out a little bit. She couldn't handle it. It was like, next time I go through this process, one thing on my checklist, can they see blood?
Right, for sure.
Yeah. Any tips or tricks that you've learned during the recovery that you wish you knew before surgery?
I think for me, I always have a lot of back pain as unrelated to therapy. I mean to surgery. I'm thinking about therapy, guys. But what happens is that after the surgery, my back pain got a lot worse. So I think that a tip that works a lot is buying one of those nursing pillows, to the big baby pillows. And you feel way better, way more comfortable.
Because we're carrying a lot on our backs now. Besides the world, being a woman. But this big old thing is heavy back there.
It
and
is.
Especially the smaller you make your waist, it's a lot of weight on there. So all the girls who want the big booties, there's some dilemmas that come with it. There's some pros and cons that come with it. So
for sure.
Yeah. Now that you've had this experience, what advice would you give someone considering to get surgery?
I would say just to do it for themselves and don't listen to people's criticism. Since I'm very very active online, I get daily criticism. So first it was I was fat, and then it's you have a lot of extra skin, and then when I started doing therapy. Gosh, I don't know
The
what
plastic
therapy.
surgery.
I'm
Yeah.
thinking about therapy. When I started doing surgeries to fix the skin problem, then I was a plastic, or I was too stuck up, or
You know what we
whatever it
say
might
to
be.
those people? F the haters. Say it with me, Gretchen.
F the haters.
Okay?
Yeah.
Haters, we see you. We don't care. Do what makes you happy 9 times out of 10. The people who are criticizing you in those comments, they want the same thing too. They just don't know
Right.
how to go about it. Or bigger than that, they don't have the balls. You know? So I'm sure in those comments, there's probably way more higher percentage of positive comments than negative.
For sure.
So it's easy for us to block it out, but we're human and we see those things and they hurt our feelings.
Yeah.
So F the haters.
It depends on the day, you know. Most of the time, it doesn't really bother me.
Yeah.
But let's say that I had a really bad day.
Yeah.
And then
You see this nasty comment. You know what I do to them? I block them.
Okay.
I block the haters. Anybody in my comments that has anything negative to say. And then here's what boggles my brain. It's always the people in the comments that are talking negatively, and I go to their page and they're following me. What the? So you're following me because you're a fan and you idolize what I have going on. But, you know, my mama taught me this. God teaches us this. If you have nothing nice to say, don't say anything at all.
Yeah.
So, Gretchen, moving forward, here's some advice. You've given me so many gems today. Here's my advice to you. Block them.
Okay.
Anybody in the comments that has anything negative to say, anything about your journey and is not there for positive reasons, because you're human, block them.
That's it. That's a good advice. It has not been the way that I've handled it. I believe that I won't block them because I think that they're just gonna see me win.
Yeah. Yeah. But it's gonna hurt them that they can't watch you win.
Oh, well, then maybe I should. I'll start doing that.
Yeah. Just a few, just to make an example. You gotta make an example. Like, oh, you're getting spicy today in my comments. Block anybody else. Okay, everybody starts chilling out. Trust me. Can you share an empowering mantra or piece of advice that you've embraced since your newfound body?
Yeah, I would say just put yourself first.
Put yourself first.
I think we, as a female, we struggle a lot with putting ourselves first. We're taught that we need to serve, and first is the kids, and first is the husband, and first is whatever else, the house. And it's very hard for us to invest in ourselves, and especially when it has to do with beauty or things like that, something that people judge a lot.
Yeah.
So I would just say, put yourself first.
Put yourself first.
When you are happy, you're a better mom, you're a better wife, you're a better person in general.
Everything. And so putting yourself first is always my key. I always tell people, if you're not happy, everybody else around you can't be happy. Nothing flourishes around you. So you have to take that time, that me time, to put yourself first. Gretchen, I want to thank you for taking time to come sit down with Plastic Surgery Tales. We're doing more than just telling a couple of tales. We're giving out the gems. We're giving out the tea. We're answering those forbidden questions that people have questions about. I'm your host, Holiday the Golden Child. Before we get out of here, guys, I need you to go like, share, subscribe. And guys, I mean, if you need a little therapy, we got Gretchen here. Go follow her. And Gretchen, thank you again for sitting down with us.
Thank you for having me.
Yeah.